Hi, I'm Dr. Janice Jurack from Muskego Health and Wellness Center. In thinking of a topic for this month's health tip, it was quite easy, as I have been a runner for over 30 years, and lo and behold, last week as I was running, I ended up twisting both of my ankles. If many of you are active in sports or a runner like myself and have ever had an injury even as a child, listen up. So it got me thinking about the structural, chemical, and emotional part of our health. And structurally, when we look at the ankle, number one, you want to make sure that all the arches on your feet are properly supported. So you have an inside arch, an outside arch, and an arch that goes across your foot. So I can show that to you on my foot. So there is an inside arch, which I don't have much, so you'll see the sandal that I wear does have extra support. There's an outside arch right here, and then underneath your foot there is a arch that goes across. Now I have been wearing custom orthotics in my shoes for years. I also wear a shoe that prevents me from turning my arches in, also called overpronation. So I knew that I had that covered. Now what had happened, I was running, my left foot hit a stick or a rock, I couldn't even tell you, again, as you know, if you've had it, it happens so quickly. But my foot rolled, and it rolled this way. And that happens to be the most common way that you can roll your ankle. Now if you want to look at my foot again, there are ligaments that run right on this area on the outside. This is the ankle bone here that run right in this area. That's the most common ligament that gets sprained. And of course I didn't sprain that one on the left side, I sprained the one above it. On my way back to my house after running, that's when I sprained the right one. My foot gently fell off of the asphalt of the road, and I sprained that common ligament. Very important, after you do something like that, any injuries, you want to ice it. You want to ice the ankle probably 5 to 10 minutes. And there's some products as well that can help for healing. I like this one, or if you can see it says arnica on it. Arnica helps with sprains, strains, and bruises. You can take it orally. You can also rub it onto the area that is injured several times a day. I started taking that immediately. I also like to use some essential oils, in particular frankincense is a wonderful anti-inflammatory. I put that directly on the injury, along with Panaway, which has wintergreen oil in it, among other things that actually help with the pain and inflammation of the injury. I always, every day, I will also take a joint support since I am no longer 20 years old. It's important to support your joints and also your ligaments. There's certain products that contain manganese, and manganese is extremely important for ligament health. So if you've ever had any ankle problems, it is easier to have future ankle problems if you don't take care of it properly, nutrition especially. Now I was not dehydrated. I was drinking plenty of water because that can also weaken your ligaments. I was taking the right supplements as well. That's also very important. And I'm eating a good diet. I don't eat a lot of processed foods. I don't eat a lot of sugar. If you're eating a lot of processed foods and sugar, you're not giving your body the nutrition it needs, and it will weaken those ligaments. If you've had emotional stress, that can also do it, which may possibly be my problem. I was not focused when I was running. Many times I'm thinking about the day, thinking about the future, thinking about, you know, solving the world's problems and not focusing on what I was doing. So that's very possible too. I will admit that. So as far as fixing the problem, nutritionally you can do so, keeping yourself well hydrated, eating very well. There's also some things that I did structurally, including ultrasound. I did ultrasound over the ligaments, which helps them heal. I also got chiropractic adjustments to the various bones of the foot that were locked in place because of the twisting that happened. Now, if you do not rehabilitate your feet properly or your ankles properly, you will risk spraining them much easier in the future because your body loses the ability to adapt to whatever terrain you're then running or walking on. You lose that connection whenever there's an injury. So to rehabilitate that, something very simple to start with is just standing on one leg. Now you try to see how long you can stand on one leg with the eyes open, and then you close the eyes and see how you do. Then of course you want to do both. This is something you can do as easy as, in the grocery store line. It doesn't have to be set specific times of the day, but several times a day if you can. And keeps a slightly soft knee so you're not hyperextending the knee. I could not do this if I did not have my orthotic sandals on, by the way. Once you feel comfortable with that, and even doing like range of motion exercises and things, you can use what's called a wobble board, where you stand on it and just try to keep it steady and see how you do. Once you're comfortable just standing on it and you can pretty much keep the board straight, you can gently go forward and gently go backwards. Now I suggest you don't look at your feet because that makes you more unstable as you do these exercises. Look straight ahead with good posture. And it's always good to have somebody else available or a wall next to you in case you do need to catch yourself. I'm not going to demonstrate this because it's only been a week since my injury, but once you get to the next level, the third level would be to stand on this board literally on one leg and be able to do the same thing. If you really want to get fancy and get complicated, there are round boards with a ball in the center that you can get more range of motion exercises for the foot and ankle too. All that is good. But you don't want to skip that step because again, you're going to end up having to spraining your ankles more easily in the future. There are braces and things, and if you accidentally sprain it enough where the swelling's not going down, pain's not going down, you definitely want to get an x-ray at that point. If you have any further questions on any sports injuries, including the ankles, please don't hesitate to call us. The number is 414-422-1203.